We've gotten lots of questions about the connection of race and COVID-19 and certain groups being having higher case numbers. What kind of light can you shed on that?
Well, we've noticed locally, and this is borne out in other locations, not only in the U.S. but across the globe, that both race and socioeconomic factors can be multipliers or enhancers of not only acquisition of the COVID illness or infection, but the outcomes after you have that infection. In Pittsburgh, people who have an underlying black heritage acquire the infection at a slightly higher rate than what is in the general population. In other words, their presence in the population. Once they receive care, at least at the UPMC sites, we don't see a difference in the outcomes after that point. But since they get COVID a bit more often, there are more black patients admitted and receiving inpatient care than there are people of other races. In other parts of the country, those disparities can be much more dramatic. Trying to unravel the part that's related to race versus other factors like population density and other comorbid or conditions that exist is really one of the avenues of research right now that we're working on. What COVID-19 has done is put a harsh spotlight on many different types of vulnerable populations, one of which are minority populations or socioeconomic disadvantaged. The elderly, we know about that too. It didn't create those differences, but it certainly does highlight where there's opportunities not only within this particular pandemic, but within healthcare in general.